My name is Dr. Ben Leavens from Main Street Pet Care in Joplin, Missouri, and I own and operate this vet clinic, and we have had Fovea for 6 years now. As a whole, Fovea has changed our practice in the sense that digital x-ray allows you to take x-rays without really thinking a lot about it. In the old days, or with other systems, you have to think about how you're going to take the x-ray, who's going to go take it. Sometimes you have to step in and adjust films or change fluids or have something empty. And it completely changed that. Now we don't think twice about shooting x-rays, and we don't think twice really about shooting them during appointments. And we get pretty busy around here in appointment time, and we just shoot the x-rays. We say, okay, we'll go ahead and then the techs take them back and shoot them. And the second part is that veterinarians rarely shoot x-rays anymore around here because the techs love to do it now. It's something that's fun for them, it's exciting, and it is high tech, and it gets instant gratification, and they really like that. So it's made us better doctors, it's made us a better clinic, and more aggressive about just taking radiographs, among other things. The big thing about for making a difference in specific diagnosis, there's been several situations where there's actually more than one way that it's made a positive difference for the patient and the client. And one way is when we're looking at airway diseases, it can be very difficult sometimes to capture a collapsing trachea, for instance, on a radiograph. And with digital x-ray, especially one that works fairly fast, you can shoot multiple images fairly rapidly, and you will capture a lot more collapsing tracheas and things of that nature that you never would have captured before. Other things are because it's so easy to take an x-ray, and one thing, in a situation where you may not have shot an x-ray, or you may have put it off until the next day or something like that, you'll do it right away and you discover foreign bodies. We've found needles that might not have been found right away. The owner might not have come back for x-rays the next day, but you find a foreign body right away, and then you have your diagnosis immediately. There's no waiting around for it or no putting it off, and the animal doesn't have to sit and suffer with a needle in the neck or some type of foreign body in the stomach and continued vomiting for another 24 hours or more pain. So it's really good that way. The other way that digital x-rays affected us, and this is more of a personal way. It actually affects the life of the technicians and assistants here at the clinic, and it affects my life. We do a fair amount of, as all veterinarians do, we do a fair amount of charity work for love. And when in the old days, if it would have taken us a long time to get x-rays, we may not have offered that at no charge to somebody. And nowadays, if I want an x-ray, or one of our doctors wants an x-ray, and we know we're not going to get paid, but we're just trying to find out what's wrong so we can do something to help somebody, we just do it. It's not a big deal to go take x-rays now. We don't have to wait around. We take them and we're done. And that has I can't tell you how gratifying that is as a veterinarian, to be able to do that for free for somebody that needs help. It makes a big difference. So.